Okay.
My name is Wes Pearson. This is my wife Angela. We've just completed a EPIC treatment here with Cognitive FX. I had a brain tumor that was removed approximately 10 years ago. It was right next to my pineal gland, and it caused some damage to my pineal gland. But I recovered from that surgery just fine. However, as a part of the surgery, I had a shunt put in my brain to help regulate the pressure on my brain. That shunt failed about 2 years ago, which then caused me to have a traumatic brain injury because the pressure on my head went from 4 to 10 times more than what it should have been. And since then, I've noticed that I've had particularly short-term memory problems, problems with the details of life, like remembering to put the lid on the milk or remembering to enter my hours in at work. Just things that have never been a problem for me before. And so I did this treatment. I started it on Monday, and almost immediately I could tell a difference. And the difference that I could tell was that I was processing things with more ease. I'm still the same person, but I can think with more ease. I can see things more readily, and I have a little more confidence in what I'm able to do. In other words, I believe my brain's going to work for me instead of having a brain that's a damaged brain. So that's, I think, one of the big benefits that I've gotten from Cognitive FX. I know that the people that did my scores have commented that for a person that has structural damage on their head, I'm the first one that got a negative score. That's great. What I know is that I think it's making a difference in my ability to think and reason and go forth and have confidence than when I started. So I'm very grateful for that.
Thank you. So for me, as the partner to the brain patient, I would say if you're watching this, then you probably have experience with brain injuries and may or may not know the difficulties, whether it's from a young age and it's hard to even know that you've had a problem, or if you recognize it, that there has been a problem. You know that it can be very challenging to have your family member change so suddenly and to try and adjust to those changes. And I think we have to kind of live in a bit of a denial in order to make it through life. And so for me, going through this process was, first of all, taking off that blanket of denial, and that was very, very painful, to actually have to realize that there's a lot of things that we're missing here and there's a lot of things that could be a lot better. But in going through the process and the treatment, it's shocking how simple it can be and how miraculous it can be to have your brain, your partner's brain, your family member's brain, be able to function again, because you see the lights come on again and you see things that you haven't seen for a long time, and it's very shocking and exciting, because I feel like Wes said, two words are ease and confidence. There's just, and even though we just finished treatments today, there is an ease, a presence that is back that hasn't been here since the injury. So the confidence is huge and the ease is huge. So for me, that's been a huge blessing, and I would recommend that you come in and take that step of faith, that leap of faith, and trust that your brain can heal. It's a beautiful thing.
And one thing I could add is the treatment covers multiple areas. So I work as an engineer, and so as I've been going through this treatment, I've of course had my questions about whether or not it's been a scientifically proven treatment plan. They address physical needs, so they address with a physical therapist your physical environment, maybe stress on your head and your coordination, that kind of thing. They do multiple games, if you will, and I don't know if they're games, but they're workouts for your body. The one that comes to mind is your Dino Vision, where you've got to hit buttons that light up with either red or green, with either the right or left hand, while reading a screen that has words, and then some of the words are going to be missing letters at the same time. And so these are put together in combination such that your body, you have to continually think while doing this. And I think that combination is very successful at helping you regain some connections. The other therapists that I worked with have been very insightful. Like, one of the things that I need to work on in the future still is my vision is a little bit off, because I have one eye that's been LASIKly adjusted for nearsightedness and one eye that's been adjusted to be farsighted. And so I don't necessarily see my images quite as clear together. And so he's given me a way to help my eyes get trained better, and that'll help your brain process things better. So little things like that I think are huge. And those are the things that this treatment has been able to give me, as well as I've been given some instructions as far as how to keep and maintain this. Because, of course, if you can have that big of a change in a short period of time, then you would kind of worry that maybe it would change back in a short period of time. So having things you can do and take away with, I think, is vital, because I plan to continue to make progress with this. So thank you, FX.
Thank you.